Anna Smith and I'm a cardiovascular rehabilitation nurse from Liverpool Heart and Chest Hospital. Today I'm going to be talking to you all about basic life support and how to save a life in an emergency situation. So the aims and objectives of this presentation are for you to understand the difference between a heart attack and a cardiac arrest, to be able to perform basic CPR, spot the signs of a stroke, understand what to do with somebody who's choking, know what to do with somebody who's unconscious but is breathing, spot the signs of sepsis, and know what to do in all of these situations. It's estimated that there's around 60,000 out-of-hospital cardiac arrests a year, but less than 1 in 10 people can survive an out-of-hospital cardiac arrest without urgent treatment. One day you could witness somebody collapse and stop breathing in your home or when you're out in public, and you could be the only person who is there to help them. So let's talk about the difference between a cardiac arrest and a heart attack. It is very common to mistake them. While a heart attack may cause a cardiac arrest and sudden death, the terms don't mean the same thing. The cause of a heart attack is a blockage that stops the blood flow to the heart. A heart attack, also known as an MI, a myocardial infarction, involves the damage to the heart muscle tissue due to the loss of blood supply, which does not necessarily result in the death of the heart attack victim or a cardiac arrest. This is usually what we call a problem with the plumbing, so a circulation problem. However, a cardiac arrest is usually an electrical problem. This is where the heart can suddenly stop working, which is usually caused to an abnormal or irregular heart rhythm called an arrhythmia. If somebody suddenly collapses and they are not breathing and they are unresponsive, it is likely that they are having a cardiac arrest. So, as a bystander, what can you do in this urgent medical situation to save this person's life? We use an approach called Dr. ABCDE. Dr. ABCDE stands for danger. First of all, you need to assess, are you in any danger yourself? Perform a quick risk assessment, and if you are not in any immediate danger, go over to the person and find out if they are responsive. This is R. Gently shake them and ask them, can you hear me? Can you open your eyes for me? If they are unresponsive, you immediately need to call for help. Ring an ambulance, shout help, and see if there is anybody nearby who can come and assist you. We are now going to check their airway. Gently open their mouth, head tilt, chin lift, and check to see if there is any occlusion. If there is no obvious occlusion and nothing is blocking the airway, you now need to check to see if they are breathing. Look, listen and feel for 10 seconds to see if the chest is rising. And if they are not breathing, you need to feel for a pulse. If they have no pulse, commence CPR. With straight arms, use the heel of your hand to push down the breastbone firmly and smoothly, so that the chest is pressed down between 5 to 6 centimetres. Do this at a rate of 100 to 120 chest compressions per minute. If you have somebody there to help you, you can alternate and take turns to ensure that you don't get too tired. If somebody has managed to find an emergency defibrillator, you need to follow the instructions. Take the pads out of the pack and attach them onto the patient's chest. Follow the instructions, they will be very clear. If there is a shockable rhythm, the machine will instruct you to press shock. The only reasons you would stop performing CPR is if the patient regains consciousness or you yourself get too tired to continue. If the patient starts to cough or open their eyes or talk, you must stop immediately. Please take a minute to look through the illustrations on the presentations. Okay. During COVID, you may be worried about performing CPR, especially as a bystander to a complete stranger. However, we do urge you to continue emergency CPR Just cover the patient's face if you are unsure if they have COVID or not. Statistics have shown that early defibrillation can save somebody's life. Within 3 to 5 minutes of somebody collapsing, this can produce survival rates as high as 50 to 70%. Therefore, it is essential that this is your first thought when somebody collapses. Find the local defib machine. So defibrillators are popping up all over your local communities. They are usually on the outsides of buildings or in large public spaces, such as shopping centres, train stations or airports. The defibrillator sits in its case and it will say AED or defibrillator. There may be this image, please see the illustration, on the outside of the defib machine. You may also see a green information poster next to the defibrillator, which has been developed by the British Heart Foundation to raise awareness of where local defibrillators are kept. When you get to the defib machine, it may be in a locked box with a code. You need to ring 999 and the person on the end of the call will give you the code to the defibrillator that you are at in your local community. Type in the code and the box should become unlocked for you to access the defib machine. You then need to get the defibrillator as quickly as you can to the person who has collapsed. Okay, now let's talk about choking. When choking is severe, the person will not be able to speak, cry, cough or breathe, and without immediate attention, they will become unconscious if you don't act quickly. Stand slightly beside them. With one hand, support their chest, and with the other hand, lean them forward and provide 5 short, sharp back blows. Lean forward, have a look at them and see if they have managed to cough up what they are choking on. If they continue to choke, repeat this again. Provide another 5 short, sharp back blows. If the person's airway is still blocked, repeat this again. If they are still choking, it's at this point that you should be calling 999 and shouting for help. Continue with these cycles of back blows until they cough up what they are choking on. You could try an abdominal thrust, commonly known as the Heimlich manoeuvre. It is important to note that if you do perform this on somebody, then they may need to go and get an abdominal x-ray once they have coughed up what they are choking on, to assess for any damage which may have been caused. If you do have any doubt that the person has stopped breathing normally, then please persist with CPR. Okay, now let's talk about what to do if somebody is breathing, their airway is patent and they do have a pulse, but they are still not responding to you. First of all, it is still an emergency situation, so I would call 999. Gently lie the patient onto their side and put them in the recovery position. Please see the illustrations on the presentation for guidance. Wait with the person and ensure they are safe until help arrives. Okay, now let's talk about sepsis. What is sepsis? Sepsis is a condition that could occur from any infection in the body. Severe cases of sepsis could result in septic shock. This is where the body starts attacking its own organs and tissues. Sepsis is potentially life-threatening, however, it's a condition that can be dealt with if caught early. Sepsis is considered a medical emergency, and some of the signs and symptoms are listed below. These include a fever or a temperature. This could be a very low temperature or a high temperature. Sometimes people often have shivering or rigors. An altered mental status, so if somebody seems confused or they seem to be slurring their words. Difficulty breathing or rapid breathing. An increased respiratory rate. Increased heart rate. If their pulse is weak, if their blood pressure is low. If somebody hasn't passed urine for over 8 hours. If somebody is passing a very small amount of urine. If somebody's got mottled skin or a rash, cold extremities, and extreme body pain or discomfort, these could all indicate that somebody is showing signs of sepsis. Please see the two lists below on the presentation. The left side shows life-threatening emergencies, in which case 999 must be called. The right side shows urgent emergencies, but not life-threatening. You can call 111 for these circumstances. If you have any questions on the presentation, please see me afterwards, and thank you very much for listening.